Use of personal protective equipment when caring for a person under investigation for Ebola virus disease in a First Nations or other community health facility. This training video is based on advice from the Public Health Agency of Canada's Infection Prevention and Control Expert Working Group.
My colleague, Dr. David Butler-Jones, and I would like to tell you about this very important initiative to help keep our healthcare workers safe and ensure they are prepared for infectious disease threats, including Ebola or other hemorrhagic fevers. Health Canada is pleased to collaborate with the Royal College of Physicians and Surgeons of Canada and the Public Health Agency of Canada to bring you these training videos. They will show how to put on and take off the personal protective equipment needed when caring for patients suspected or confirmed to have Ebola virus disease in a First Nations community health setting. Training and repeated practice is necessary to ensure when personal protective equipment is used, it is done so in a correct and safe way. These videos are to be used along with the in-person training.
These videos are an important part of infection prevention and control training, both now and in the future, to help refresh and maintain these essential skills on an ongoing basis. We recommend watching these videos regularly as a reminder of the important skills learned during in-person training. Our goal is to ensure healthcare workers and First Nations communities are prepared for any serious communicable disease event, including the Ebola virus disease. We hope you find these videos a valuable contribution towards our efforts to protect and be protected when dealing with potential risks.
Recommended personal protective equipment, donning and doffing processes where there is a lower risk of exposure to blood or other bodily fluids, that is, no anticipated contact, direct or indirect, with blood or other bodily fluids. Please note that the sequences for donning and doffing may vary according to the type of personal protective equipment in use at your health facility and based on the point-of-care risk assessment. A risk assessment approach should be used before and during every interaction with a patient under investigation for Ebola virus disease to support the use of additional infection prevention and control measures where indicated. This video segment demonstrates the donning sequence of personal protective equipment for lower risk of exposure to blood or other bodily fluids. The recommended personal protective equipment used in the following lower risk scenario, as per the point-of-care risk assessment, includes a fluid impermeable gown, a fluid-resistant mask, a face shield, and gloves. Donning, Step 1. Prepare for donning personal protective equipment in a designated clean area. You, the healthcare worker, together with the trained monitor, perform self-care such as hydrating and going to the washroom. Remove all personal items such as stethoscope, cell phone, jewelry, identification tag, pens, and other items. Pull hair back and away from your face and neck and secure it in place. Ensure that your fingernails are trimmed to prevent tearing of gloves. Perform hand hygiene thoroughly and effectively using alcohol-based hand rub or soap and water if hands are visibly soiled. Note: the proper technique and complete hand hygiene procedure is being demonstrated in this step. Subsequent hand hygiene steps have been abbreviated. Ensure that you have all the personal protective equipment required. Inspect the personal protective equipment for defects and appropriate size. Most importantly, be attentive and careful, and take your time in donning the personal protective equipment. Supporting you is a trained monitor whose role is to assist, assess, and document your appropriate selection, use, removal, and disposal of personal protective equipment.
Put it up towards your head. Yeah, make sure it's a good fit. Yeah.
The trained monitor reads aloud all steps throughout the donning procedure and ensures all steps are performed properly. Step 2. Perform hand hygiene thoroughly and effectively as demonstrated in donning Step 1. Use alcohol-based hand rub. Step 3. Put on fluid impermeable gown. Ensure that the gown is cuffed and long enough to cover from your neck to your knees and also to your wrists, including sleeves. Fasten the gown securely at the neck and waist. If the gown has 2 sets of waist ties, tie the inner tie first, followed by the outer tie, with edges overlapping to completely cover your clothing, both front and back. The trained monitor can help fasten the gown at your neck and waist to ensure that no clothing is visible. Step 4. Put on fluid-resistant mask. Mold the metal piece to the bridge of your nose with 3 fingers simultaneously on both sides. Ensure that your nose, mouth, and chin are fully covered with minimal gap between the mask and your face.
So lift the ends. There was too much. You could see right through.
If there is a gap between the mask and your face, make a knot in each ear loop to tighten it.
Make sure you fit under.
Note that masks with attached visors are not suitable. Step 5. Put on face shield. Ensure that the face shield is long enough to prevent splashing underneath and that it fits over prescription eyeglasses if wearing. Secure the strap at the back of your head. Note that eyeglasses are not suitable eye protection. Step 6. Put on gloves. Ensure that the gloves are durable and fit appropriately for the task. Fit them securely over your gown cuffs. The trained monitor can help position the gloves over your gown cuffs. Examine the gloves for intactness and proper fit. The donning procedure for lower risk of exposure to blood or other bodily fluids is now complete.
Okay, you watch me.
To ensure proper fit of personal protective equipment, perform a few range of motion exercises, such as looking up and down, bending forward at the waist, and extending arms above your head.
Just put your arms out to the side. That's good. And all the way up over your. And then come down. Just put your arms out now and have a look. That's good.
The trained monitor then inspects front and back to ensure proper fit of personal protective equipment.
Yeah.
You are now appropriately attired to provide care to a patient suspected or confirmed to have Ebola virus disease, where there is a lower risk of exposure to blood or other bodily fluids. If, at any point while providing care to the patient, the point of care risk assessment indicates increased risk of exposure to blood or other bodily fluids, or you have any difficulties or unintended breaches with your personal protective equipment, such as fogging of the face shield or tearing of the gloves, or unprotected exposure to blood or other bodily fluids, you should stop providing patient care after ensuring the patient is safe, leave the patient room, and calmly and methodically remove your personal protective equipment. Then, as required, follow your health facility's Ebola exposure management plan and put on a new set of personal protective equipment before continuing patient care. This video segment demonstrates the doffing sequence of personal protective equipment for lower risk of exposure to blood or other bodily fluids. Doffing Step 1. Prepare for doffing personal protective equipment in a designated soiled area located immediately outside the patient room. The trained monitor performs a point-of-care risk assessment and dons the personal protective equipment required in order to safely assist you, the healthcare worker, as soon as provision of care is completed. After leaving the patient room, you step into and remain in the designated soiled area right outside the patient room to remove and immediately discard your personal protective equipment into a designated, sturdy, no-touch, leak-resistant biohazard waste receptacle located there. In the following demonstration, as the healthcare worker is not visibly soiled, the point-of-care risk assessment indicates lower risk of exposure to the trained monitor. Therefore, at a minimum, the personal protective equipment used by the trained monitor includes gloves. The trained monitor remains in the designated clean area the entire time while helping the healthcare worker in the doffing process. The trained monitor reads aloud all steps throughout the doffing process and ensures that you are attentive, careful, and taking your time to reduce your risk of self-contamination. Inspect your personal protective equipment for visible contamination, cuts, or tears. Remember that additional opportunities for hand hygiene may be present based on the point-of-care risk assessment. Most importantly, be attentive and careful, and take your time in doffing your personal protective equipment to reduce the risk of self-contamination. Step 2. Remove gloves. Use glove-to-glove technique to remove gloves away from your body as follows. Grasp the outside edge near your wrist and peel it away, rolling the glove inside out. Then reach under the glove on your other hand and peel it away. Discard both gloves immediately into the designated waste receptacle. Step 3. Perform hand hygiene thoroughly and effectively. Use alcohol-based hand rub. The trained monitor pumps it into your hands without touching you. Be careful not to touch the cuffs or sleeves of your gown. Note: the proper technique and complete hand hygiene procedure is being demonstrated in this step. Subsequent hand hygiene steps have been abbreviated. Step 4. Remove gown. To reduce your risk of self-contamination, the trained monitor unties the outer waist tie to open your gown at the back and expose the inner tie. Then unties your inner tie at the back and unfastens your gown at the neck, gently pushing the gown off your shoulders, being careful not to touch the inside of your gown. You then reach under the gown cuff of one sleeve and gently slide it over your hand. With your hand covered by the gown, pinch the gown cuff of your other sleeve to remove it. Pull and remove your gown without touching your skin or clothing or agitating the gown unnecessarily. Turn the gown inside out on itself and roll it up. Discard the gown immediately into the waste receptacle. The trained monitor removes and immediately discards gloves into the same receptacle and performs hand hygiene. Step 5. Perform hand hygiene thoroughly and effectively as demonstrated in Doffing Step 3. Step 6. Remove face shield. Bending forward from the waist, grab the strap toward the back and pull it over your head, ensuring that the bottom of the face shield does not touch yourself. Gently allow the face shield to fall forward. Avoid touching the front of the face shield to prevent contaminating yourself. Discard the face shield immediately into the waste receptacle. If you wear prescription eyeglasses, be careful not to drop them when removing the face shield. Step 7. Perform hand hygiene thoroughly and effectively as demonstrated in Doffing Step 3. Step 8. Remove mask.
Sometimes just bend forward a little.
Grasp the loops from behind your ears. Pull them forward off your head, bending forward from the waist to allow the mask to fall away from your face. Avoid touching the front of the mask to prevent contaminating yourself. Discard the mask immediately into the waste receptacle. If you wear prescription eyeglasses, be careful not to drop them when removing the mask. Step 9. Perform hand hygiene thoroughly and effectively as demonstrated in Doffing Step 3. Step 10. Exit designated soiled area. Remember to perform self-care as required. The doffing procedure for lower risk of exposure to blood or other bodily fluids is now complete.
Hi, I'm Erin Henry, Director of the Communicable Disease Control Division in the First Nations and Inuit Health Branch of Health Canada. These videos were developed to complement comprehensive in-person training and practice sessions provided to healthcare professionals working in First Nations on-reserve health facilities across Canada. It is important to remember that in order for personal protective equipment to be effective, you must receive prior training in selecting and using the equipment based on the point of care risk assessment. This includes using and practicing the correct techniques for donning and doffing, discarding into designated waste containers, and effective hand washing to minimize the risk of transmission. The information presented in the videos is based on currently available scientific evidence and may be reviewed and revised as new information becomes available. What is key is that all techniques shown are based on infection prevention and control principles and precautions to guide you in protecting yourself, your patients, colleagues, and others.
For further information, please visit canada.ca/Ebola virus and royalcollege.ca/Ebola. This video is made possible by a joint collaboration between Health Canada, the Royal College of Physicians and Surgeons of Canada, the Public Health Agency of Canada, and IPAC Canada.